My name is Richard Klingler, and I was born in California, but I've only spent about 4 years of my life in that state. I finished high school in Oregon, but I'm not an Oregonian, obviously. And then I went to the Medical College of Virginia and graduated from there 48 years ago. So that was at a time before cell phones, computers, MRIs, CAT scans, and ultrasound. If those modalities were in existence, they were really test bed items. They weren't used, in the mainstream. And so after completing my medical education in Virginia, and at the time there were only 2 medical schools. Now I think there might be up to 4. So, but I then did a internship at Gorgas Army Hospital in Panama, in the Canal Zone, and subsequently dabbled in various things, and I practiced a little while in Montana, and eventually entered a Army surgical residency training for 4 years, and completed that training in Hawaii. I did some pre-surgical training at Army base in Texas before I went to the Army hospital in Hawaii for my surgical residency. Following that, I was an Army surgeon for a while, and then the Army had some needs in aviation medicine, so I dabbled in that. I've done various other things, I completed the surgical residency, but not other training per se, which is fine. I did the surgery in the Army, and then decided that there were some other things. I've done a lot of emergency room training and work, and ended up just in family medicine without obstetrics. I have done obstetrics. When I was in practice in Montana, I delivered about 324 infants, but that was at a time when fetal monitoring was not mainstream, and we were so far out in the rural areas, there was not all the safeguards available there that we have now. So growing up, I had like a lot of people, various jobs, some of them full-time, some of them summertime. I was a teletype operator for an airline. I worked doing boat construction and small 5-meter boat racing in the Chesapeake. I did construction. I delivered flowers. I did various things. But the one job I had, I can't even forget when it was. I was a surgical orderly at a hospital in Virginia, and was involved with a lot of things in the hospital, although I had no formal training. And that kind of piqued my interest, and so one thing led to another, and I eventually ended up going to medical school. Well, at my age, my wrinkles and bald head and what have you, I think I like to engage people in conversations, asking them about things that I'm not aware of. I have a limited knowledge of agronomy and agriculture and cattle, pork, so I usually ask a lot of questions, and I think that probably allows people to kind of engage a little bit more conversation oriented. That's how I like to approach things. Mr. Snow and I worked together in another adjoining town for some years. I've known him for a long time. And he had contacted me when they needed another provider over here. And so I knew of the organization, and it was all good. I came over here and was very impressed. And I think the area that we serve, they realize that we have a lot more here than a lot of other hospitals in smaller communities like this. Seeing 20 skin conditions every day, that might be okay. Or ophthalmology or things of that nature. But I think the variety is probably what is good. Well, what I used to like to do a lot of, I can't do here. My whole family enjoys downhill skiing, which we did tons of in Montana. Fly fishing out in the West. My two oldest sons are strictly fly fishermen, but we're not lake fishermen, so we don't enjoy too much of that around here. I do have a passion for shooting. I do a lot of shooting with firearms, and my kids enjoy firearms. They all have concealed permits, and so my oldest daughter loves it, so we shoot quite a bit, she and I. So not every hospital enjoys a respiratory therapy department, on-site MRI, CAT scans. We have an excellent lab, well-trained. We have excellent nurses, and we do have visiting specialists that do surgery, orthopedics, urology, so that's good, and podiatry too. So that's very handy for the local population. But I can't think of anything in my many years, many different places that I don't have anything at all negative to say about Berry County. It's all good. The people I work with are great. So I think this is an excellent resource for the community.